So another issue that we deal with quite frequently are animals that have been having a seizure. Sometimes it's one, sometimes it's multiple. This can be an incredibly distressing thing for an owner to watch. And understandably, most of us owners don't have many tools to deal with that situation. So when your pet's having a seizure, it can actually be a huge spectrum of signs, but for the most part, what we associate with seizures are what we call grand mal seizures. That just means that it's essentially the whole brain that's affected. What that looks like externally is normally your animal will lose consciousness. If it's a dog, you might notice a bit more of an obvious collapse, maybe to one side or the other. Very often they are incontinent and lose control of some of those fluids. Very often as well, they start to contract and relax their muscles very frequently. It is sometimes reported that animals sort of arch their back, throw their head back towards the ceiling, and very often they will develop a lot of froth around their mouth as well. So if you do notice that your pet's having a seizure, there's a few things to think about and ways to approach that situation. I'd say one of the big things to know is that you're unlikely to be able to affect whether that seizure finishes quickly or takes a little while just by being around. If we're going to have an effect on that situation, it's probably going to be in a vet clinic with some intravenous medications. For the most part, the biggest thing you can do is just to try and limit any secondary damage. So depending on where that seizure happens in the room or in the space, animals can hit their head or hit the other parts of their body on different objects. So if you can just clear a bit of a space, maybe provide a bit of cushioning as well. I would be very cautious about putting yourself as an individual too close, particularly to the mouth. Those animals are not conscious, and very often they will bite or accidentally cause some trauma to yourself. So just give them lots of space, try and make sure that they're not banging themselves on anything, and then make some plans to pretty immediately bundle them up and get them into an ER. So when you bring your animal into emergency and that animal has been seizing, we'll make a little bit of a judgment call at that point as to whether the animal is still seizing or whether perhaps that process has actually finished. Either way, we're going to want to assess that animal right away. So when you come in, we'll either call a triage bell or you might hear an emergency bell ring. A member of our medical team will come out right away. They're going to assess very quickly. They'll ask you a couple of questions, and they're going to bring that animal right to the back. The main things that we're going to be doing back there are trying to assess, what level of seizure we're at that point in time. We're going to check a few reflexes, take lots of vitals. We're also crucially going to place an IV catheter as soon as we possibly can. So that IV catheter, if there is a seizure still happening, we're going to place some anti-seizure medication through there. If not, we're going to want to leave that in place so that if we do have a second seizure or a follow-up seizure, we can affect that situation and give the right meds at the right time. As soon as we've got your animal stable and we've placed that IV catheter, what we will do is we'll pop you in a room, and we're going to have a conversation as a medical team with you. We're going to want to try and explain to you what our best thoughts are at that point as to why the seizure has occurred. Very likely initially we're just going to have lots of possibilities. We'll learn a lot from the exam, but a lot of the learning comes from doing some follow-up tests. So we're probably going to want to advise you on which test would be appropriate. In the meantime, we're going to make sure that we have that IV catheter in place so that we can stop any follow-up seizures. And we're going to have a bit of a discussion to you about how much we're expecting another seizure or not at that stage.